right, so welcome again. Thank you all for joining us. For the sake of time, we'll go ahead and get started. Yes, thank you, panelists, if you wouldn't mind turning on your cameras. My name is Anaisa Costa. I'm the Senior Coordinator of Recruitment for the College of Public Health. And with partnership with Amber Richmond, our alumni manager, we were able to get this alumni panel together for everyone, and we're excited to have you all here. And so I'll pass to Amber really quick, and she can introduce herself and introduce Lynn, who will be conducting our panel. So thank you all again.
Hi all, my name's Amber Richmond. I'm the manager of alumni engagement for the College of Public Health. So today here we have our recent undergraduate alumni career panel to share ways that they've navigated the job market and what they've been up to since they've graduated and give any advice. But I will now hand it off to Lynn.
Thank you, Amber, and thank you, Anais, for putting this together. Hello, everyone. I'm glad to welcome you here to our undergraduate alumni panel, hosted by Office of Student Affairs and Alumni and Student Strategic Initiatives. Really lovely to see you. As Anais and Amber said, my name is Lynn Duran. I'm the Assistant Dean for Student Affairs. And I'm really happy that you are all here. As they also said, I'll be your moderator for this panel. And I think this is a really great time to do this because we are at sort of the beginning, second day of National Public Health Week. So a happy Public Health Week, everybody. Our recent undergraduate alumni, as you know, well, they're going to discuss, why they chose to attend the University of Arizona Zuckerman College of Public Health, and how their experiences in the college and beyond have influenced their career development. So hopefully students who are here listening to this panel, you'll gain some valuable insights, hear some personal stories maybe, and learn from the successes and challenges faced by our alumni as they navigate their paths in the public health field. This promises to be a great source of motivation, I think, for both the students and the alumni, if they, listening to students' questions. So, without further ado, we did ask each panelist to prepare a 5-minute introduction, just talking about their career path, the career path that they followed after graduation from the University of Arizona, and how they arrived to where they are today. They will discuss what they currently do, where they feel their industry in the public health field is going today, and any guidance they might like to add for you. And I guess I just looking on my screen, let's start with Shelby.
Okay, everybody can hear me, right? Okay, perfect. Hi, everybody. My name is Shelby Norwood. So 5 minutes about how I got here. So I graduated in 2015 from the College of Public Health with a bachelor's in science. I really wanted to do epi. That was kind of where my brain was when I was an undergraduate. And so I focused in environmental health because I thought that was kind of where the best place for epi to be at the time was. I actually got accepted into the graduate program at the University of Arizona for epidemiology. In between that summer of graduating with my undergraduate degree, I was working in retail. I was working at like Nordstrom, Victoria's Secret, things like that. And I really wanted a big girl job. I know that sounds funny, but like that's really what I thought. And so I was looking on the county websites for careers, and I saw something called an environmental health specialist. And I said, I didn't read the job description, which I do not recommend doing before applying for anything. But I said, I focused in environmental health. I can do this, right? Went to the first interview, and it was kind of like a quiz, like name the big 5 diseases and the symptoms that you shouldn't work with food. And I was like, oh my goodness. And I kind of guessed, and I went and cried in my car afterwards because I said I did not prepare for that interview. I was not ready. And somehow I got a call back that I got the job. So I started working as an environmental health specialist, which is basically a fancy name for a health inspector, with Pima County in June of 2015. I did start my master's, decided that EPI wasn't really for me after really working with food and operators. So I worked for Pima County as a generalist. That's kind of what they call it. So I inspected pools, mobile home parks, public schools, hotels, and then food. Food was the biggest part of kind of my job, but I did everything, a little bit of everything. After a couple of years with the health department, I did get a promotion to be a trainer. So I got to train new health inspectors on how to basically do inspections. And then I also helped them pass their REHS exam, which is a certification that you need to be an environmental health specialist within Arizona and usually around the country. After a couple years of doing that, I decided while attending a conference that I wanted to go to Vegas. I heard a lot about Vegas and food safety was a big thing there. So I did actually meet somebody at the conference that was basically an internal health inspector here in Las Vegas. And he kind of mentored me and kind of helped me work towards that. The Aria position opened and I said, it'll be great experience for me to apply. There's no way I'm going to get it. And somehow they loved me and I loved them. And so in December of 2019, I came to Vegas and I've been here ever since. So I oversee food safety operations here at Aria Resort and Casino, as well as Vdara Resort on the Strip in Las Vegas. And I've also taken over some corporate responsibilities as well with writing SOPs, looking at HACCP plans, basically anything and everything food safety that you can think of, I've done. In terms of the future for this career, it's a little hard, right? Like, when I was thinking about EPI, I was like, well, I'm going to sit at a desk all day. I'm not going to do anything except for if there's a pandemic, which how often does that happen? Joke's on me, because that did happen right after I moved to Vegas. So I think when it comes to food safety and things like that, I think things are changing. We are seeing a little bit more outbreaks for different diseases. I mean, we could have another COVID thing where it could be, you know, another outbreak or things like that. But technology has really come a long way when it comes to like blockchain, oh my gosh, blockchain traceback and things like that. We've had plenty of tours here of like, okay, if we get this thing from this supplier, how do we trace it back if there is a recall or something bad happens? So super exciting things going on. I'm really excited to see where technology takes us next. And I think COVID really pushed us to be more technologically savvy. And I think that's everything that I have for my first introduction. Thank you.
Thank you, Shelby. Wow, how exciting! Going from Tucson all up to Vegas and doing some corporate work. Thank you. Let's go ahead and we're going to move on to Hiram.
Hi, good evening, everyone. How's my audio? All right. So a little bit about me. So my name is Hiram, and I'm currently a program coordinator at Equality Health, and I specialize in health literacy and CBO, or community-based organization engagement. And basically, I attended the University of Arizona just for the last 2 years of my bachelor's degree, specifically to complete the core public health courses. Now, prior to that, I attended community college where I completed my general education requirements. Now, when I began my studies in public health, I wasn't too sure what the focus or my specialization was going to be. And at that point, I was basically just learning what public health was because I had like no idea what it was. I just had a surface level that it had to do with preventing disease, which was like what I wanted to do. And it was like the main motivator for me as far as my career goes. And so I come from a rural, border community where access to healthcare, especially specialty care, is not the greatest. And early on, I clued into the fact that people that live in those types of environments, they often tend to have worse health outcomes than people living in urban environments. And so for me, this is like one of the big, I guess you could call it an aha moment that led me down this path of pursuing public health as a career. And during my studies, I primarily explored the environmental and occupational health side of things. And though this was not exactly what I wanted to do. Now, I had a very vague idea, but a couple years after I graduated, I actually keyed on what it was exactly that I wanted to do, which is now health promotion, health education, and health communication. And that isn't to say that the time that I spent at the college focused on environmental and occupational health was wasted. I actually learned a couple of useful concepts and a bit of hard science that has been useful in some instances in my career. And really, when you get down to the nitty-gritty of it, I think that there are certain ideas within public health that transfer across the various areas of focus within public health. And maybe you can dive into those at a later time. But now getting back into my actual career, I graduated a couple of years back, 5 years ago, 2019, and during the very first couple of months outside of school, I had difficulty getting into roles. And really, it wasn't until like 2 years that I was outside of school that I was able to finally get a role that I was looking for, then interested in, and that was in public health. And so the way that I was able to do that is because I leveraged my professors. They were nice enough to introduce me to people that were working in the field that I then connected with. And through them, I was able to get a foot in the door, so to speak, and get like my very first role, which was with the Pima County Health Department. So another Pima County Health Department past employee here. And so I started as a tobacco and chronic educator. And throughout that, I learned all about there was student about tobacco control. And then about a year into that role, I shifted into health literacy, which is now basically my main area of expertise. And I spent another year at the department, about 2 years in total. And now, recently, about 6 months ago, I transitioned from public health to private sector healthcare. And what I do now is I work for a healthcare company that focuses on transitioning independent healthcare practices from fee-for-service healthcare to value-based care. And so my main role with that company is being a collaborator in implementing the company's health equity strategy. And so as far as the future goes for healthcare, which is what I'm focusing on now, I think that value-based care is going to be a big, and is starting to be a big shifting force in healthcare here in the United States, as well as the digitization of healthcare. And as far as the broader public health field goes, I think that we've unfortunately seen a lot of professionals transitioning away from the industry, due to burnout and also due to government underfunding, unfortunately. And so I think that in closing, I think that the main piece of advice that I would give you as professionals going into the field is to learn how to advocate for the profession itself, as well as learn how to communicate the value that we as professionals bring. And so I guess in closing, that would be like my main piece of advice.
Thanks, Hiram. That's a very good point about being able to advocate. I think that, healthcare, public health is an important aspect of everyone's life. And it's a little bit surprising how little it is given funding and whatnot. Thank you. Cori.
Hi, everybody. My name is Cori. I think I'm one of the more recent public health graduates here, so I might not have a full 5 minutes for you. I received my public health degree with an emphasis in health education, health promotion in fall of 2020. I went to the university knowing that I wanted to do something health related. I kind of was in the mindset that I would go into nursing, which I think is where a lot of people start. And after struggling through my first chemistry class, I knew that that was probably never going to happen and that I didn't want it to happen. But I still wanted to stay within the realm of health. I had a friend that was on track to do environmental health with a public health degree. I still wasn't sure what emphasis I wanted to do, but I heard about the public health tracks. I looked more into it, and then I ended up deciding to stick with that, and I absolutely loved it. I really enjoyed my time learning about all aspects of public health at U of A. And after, I think in my junior year is when I decided I wanted to do health education. I wasn't really sure where I wanted to go with that and what exactly I wanted to do with that, but I knew that I really felt strongly about educating the public, educating rural areas, educating people who just didn't have the type of access to health that other people are so privileged to have. So I wanted to do something with that. I had a really awesome advisor while I was at the U of A. So she mentioned the certified health education specialist track. So I received my degree in fall of 2020, right during COVID. So I didn't have a graduation, unfortunately. Finished all my classes online, and knew that I wasn't going to be going into a master's program, at least not at first. I wasn't sure exactly what I wanted to do. So I took a couple months to myself to just kind of continue working the job I had at the time, which was in the restaurant industry as a server, and then decided to start applying for different health education positions in Tucson. So I applied for, I think, a couple health department positions. I applied with some nonprofit organizations and ended up getting a interview request with a nonprofit that focused on sexual health education, peer pressure education, pretty much all aspects of health education with youth. So I went in, gave a pretty good first interview, I think, because I got a second interview. And the second interview was actually pretty different than what most people would experience because I had to pretend I was teaching sex ed to a room full of children that were actually adults that were interviewing me. So that was definitely nerve-wracking, but I, again, think it went well because I ended up getting the position. So I worked with this nonprofit for a little under 2 years. I did really enjoy my time educating youth on these topics. They're really important topics. They're topics that some people never even receive based on, you know, if they're being taught at school or if their parents are talking to them. Some people just will never hear about, you know, all everything in that area. So I really did enjoy working with the students and getting to educate them on such important topics, but I was ready to kind of move on from the nonprofit work. As some of you may know, it's a lot of work. It's usually a lot of work outside of what your job description is. And oftentimes it's not paid in a way that is honestly acceptable for the cost of living. So I then decided to receive my next level of certification and decided to start studying for the CHES exam. So basically, this is a health education specialist certification. And I went on to study for that, took the test. It was a really awful online test experience, and I'm so glad that it's over and that I did pass. And in fall of 2022, I found out that I did pass that test. So I kind of took that as an opportunity to begin exploring other positions. So I had heard really good things about working for the university. I started looking into health education positions with the university and ended up finding a community outreach coordinator position with the Arizona Poison and Drug Information Center. I never really had any interest in poisonings, envenomations, anything of that sort, but I thought it sounded very interesting. and ended up interviewing with them. And long story short, I got the position. So I have been with the Arizona Poison Center for, I just hit 1 year in beginning of January, and I get to do all things health education and poisoning prevention with snake bite awareness and medicine safety and opioid overdose and pretty much anything you could think of in the realm of poisonings. I get to go out and do health fairs and presentations and everything of that sort. And it's really interesting. I'm always learning something new. And I have felt the pressure of wanting of going back to school to get a master's, especially working with the university. But I honestly feel like that's just not for me, at least not right now. And I do feel like that my certification as a health education specialist is what really landed me this role. So I would highly recommend, if you're not thinking about going back to school, looking into other levels of certification. In terms of the future of health education in general, things are always advancing. There's always new strategies coming out on how to best give the public health information and prevention information. I think something right now that's we all know is really taking off is AI. So there is some talk that maybe there will be things with AI in the future to help the health education field. But it really is just kind of moving forward. There's nothing really comes to mind on anything specific right now on where it's going. But I do feel like there's always going to be a position out there for somebody who wants to do health education, which is really reassuring. And I think that's pretty much it.
Thank you, Cori. Yes, I think that health education advocacy is done in many different places and many different ways. So thank you. All right. So I have some prepared questions for you, and depending on who wants to begin, just let us know. So my first question would be, what skills or knowledge did you learn while attending MESCOP with Zuckerman College of Public Health that you find has been helpful in your career and your current role?
I can go first. The first thing that comes to mind is social determinants of health, which for a lot of people is something that just kind of comes to mind. It's kind of an obvious thing that, depending on where you live, family history, so on, everything, and the social determinants of health, it will really affect health outcomes. But if you come from a more privileged background and health backgrounds, you might not think about that. So you might not really know that. And I was lucky enough to come from a background where I always had access to healthcare, and I always had health insurance, and I always had a reliable support system and so on. And so learning throughout my years in the College of Public Health about the social determinants of health and how that really will affect everybody's life and everybody's future and generations just is really helpful in the field of health education, because you go into everything with more of an open mind. You understand backgrounds a little bit better, and that's just something that will always stick around if you're in the public health field.
Fantastic. Social determinants of health. Shelby or Hiram, do you have anything else you would like to add to what you learned? What kind of knowledge has carried?
Yes, definitely. I would say that the systems perspective of health, I mean, for me, that was like the major piece of knowledge that I took away from my education at MESCOP. Because through that perspective, you can see the multitude of factors that affect individual health, going back to the thing about social determinants of health. But also through that system perspective, you can then see which different sectors you can involve or need to involve in order to improve the health outcomes of specific communities. Second to that, I would also say learning about where or from which organizations or agencies you can obtain data from to one, assess the health of the community, and to then use that information to be able to prioritize actions and efforts. And I also think that the brief introduction that our introduction to public health course gave us on the 10 essential functions of public health and the core services, that was really useful. I would have appreciated if that were a course in and of itself. But I think that just knowing or knowing about the 10 essential services, that gives you a pretty good framework on how you can think about public health as what it is about, really.
Thank you. I'll have to make sure that students know that and take particular note. Shelby, did you want to add anything else?
It definitely is not like what Hiram or Cori said, but the structure of most public health classes, at least for me, were very discussion based. So it's not like I wouldn't call it a hard science, but I guess a hard science where like 2 + 2 = 4 and there's no discussion. Like when we're talking about social determinants of health and things like that, like because person A lives in this zip code and person B lives in this code, why do we think that they have different life expectancies or different health outcomes? And having that type of discussion really helped me in terms of being a regulator, because I can tell somebody that your food has to be at 41 or below. That's the danger zone. You have to stay like that. But they might say, it gets busy. I don't have the funds to fix this cooler. I don't have, and having those discussions and being able to kind of come to a resolution where we're both happy really was a big skill that public health classes helped me with when I was in my undergraduate studies. That's all I have to add. Great answers from Hiram and Cori as well.
No, I think that's great. And what I'm hearing from all of you is that it's really opened up your mind to health disparity, health equity, and knowing that there are privileged people that, you know, you don't even think about it. And then there are these, like you say, just 2 different zip codes, and they could be in close proximity. Yeah, that's awesome. Have any of you been on a hiring committee before? Okay, Shelby, we'll start with you. So what do you look for in a candidate? What makes someone stand out during the job, the process? You know, I don't know if you could talk about the materials you received from the applicants, cover letters, resumes, what they said. You know, can you just kind of expand upon, you know, what you look for in a candidate and what makes them stand out to you?
Yeah, definitely. So I will talk about my time at Pima County when I was a trainer. So I was sitting in on those hiring panels for new EHSs. And just in case anybody wants to be an environmental health specialist with Pima County, it is a score-based interview system. So like they will ask you, what are the 5 symptoms and 6 diseases that you're worried about? And it's 11 points. And if you don't get those, you get 9 out of 11. Person with the highest points gets either a second interview if it's really close, or you get the job, pretty much. But when I was looking for like in those second interviews, so once people had gotten their scores pretty close together, like they had the base knowledge that they needed, and we really were looking for personalities. What I was looking for those things is having an open mind and being able to have like soft skills. I think that's something that even here, when I've sat on hiring panels for not necessarily food safety, but stewarding, they clean our kitchens for stewarding managers. Those soft skills, you can know food safety like the back of your hand. You can tell me what temperature foods have to be, how they have to be. But if you can't communicate that to somebody, you're never going to get people to do what you want to do, and you're never going to be able to keep food safe when you're not there. So I think that's something that's really big that I used to look for in interviews, and I still look for now, is those soft skills and really those people skills. In terms of resumes and cover letters, making sure that they are individualized. They're not just like a generic cover letter. They're specific to that job. As well as your resume, you should tailor your resume to that specific job position. And then make sure you attach it, because there were there still is here at MGM, where we have chefs that apply for jobs, because I do share my office with a chef. We have chefs that apply for jobs and they don't attach their resume. And so it's like you're automatically out of the running because you don't have your resume attached. So being really, really cautious when you're applying for jobs, making sure it's personalized and individualized to that job, and then making sure that you're following all the directions. That's all I had.
Thanks, Shelby. Hiram or Cori, do you have anything you want to add? Hiram.
Yes, definitely. So I've only been on a hiring committee 2 times with the health department. And so the thing that sticks out to me in those sort of interviews, or that sort of process. So government interview, processes tend to be a little bit more strict in terms of meeting the requirements for a specific job or a role. And so what I look for is the confidence that the candidate projects when they're, explaining their own experience, and also being able to relate their past experience to the specific requirements of the role using the language of the job posting. I also like conciseness when it comes to communicating their experience. So when they give the information in a way that it's not too long, not too short, but just the right amount of detail. And in terms of the materials themselves, I'll echo what Shelby just said around tailoring tailoring your application to what the hiring team is looking for.
Yeah, absolutely. And Cori, did you have anything that you wanted to add?
Nothing too much in addition to what Hiram and Shelby were saying. I think everything they were saying spot on. Everything was great. I was on the hiring committee not for too long. I worked with hiring interns, public health interns that worked with the nonprofit that I was working with, the youth wellness. And things that they didn't mention that come to mind for me is just kind of the basic things, but some people do need a reminder. Always dress the part. Don't show up in a crop top and shorts, which, that happens. Somebody showed up and we did end up hiring her. She had a wonderful resume. She had good communication skills, but at the end of the day, that did kind of stick with us that, she showed up not really looking the part. I would say eye contact, when you're communicating, just having those friendly general people skills is going to go a long way, and just being yourself. It's so normal to be nervous. I was nervous when I was interviewing people, and so I can't even imagine how some of these interns felt coming in still in their college roles, and not even at the point where they're looking for a serious job yet. But so just, it's normal to be nervous, but always be yourself, communicate, eye contact, dress the part. And that's pretty much all that comes to mind for me.
Great. Yeah, I hear that. Yeah, soft skills. I think in being able to concisely explain details or concepts that might be difficult for the lay person at times. I think so. That's what I'm hearing from you. Thank you. And my next question is, what advice would you give to students or alumni that are unsure of what direction they want to go in their career? For example, whether they are not sure what area in public health they want to focus on, or if they're debating on going to graduate school, etc. Just what kinds of advice would you give somebody who's sort of, in that gray area that they're kind of undecided?
All right, so I guess I'll jump in. So I think, and this might seem a little bit like cliche, but I think that definitely trying things and not being afraid of, failing. I know that typically our education system makes us afraid of failure, but really you're not gonna know what you really want to do unless you try different things. So that would be my big piece of advice. The second the best thing that I would recommend is to connect with people or with others who have more experience than you, and that also are doing something similar to what you think you might want to do. So also, if you have the opportunity to, get a mentor or a coach, I'd say definitely take it because it will save you a lot of time and it also provides you with a different perspective.
Great. Cori, Shelby?
Yeah, I think networking with people goes such a long way, and we hear that throughout our entire college careers is, networking is important, and make sure you're updating your LinkedIn and doing all the things that you need to do to network. But it really does go a long way. So going to the fairs, the different like health fairs, college fairs, even if there's like a community health fair, walking through and seeing the different tables that are there. Maybe you'll see an organization that you might be interested working with. Like I said, I had a really awesome advisor when I was in my undergrad, and she told me about the health education specialist certification, and that I probably wouldn't have known about or even heard of unless she had told me. So just really networking and communicating with people goes a really long way. Also, yeah, just trying out different things. Like Hiram said, that's a really good point as well. I can't really speak to going through grad school, but like I said, I feel like it's not for me. So if you're feeling like it's not for you, look at other areas of certification. If you really do want to kind of level up from your undergraduate degree and you want to find something else, but maybe not go back into school, because certifications and experience with internships or jobs, adding things like that to your resume really do go a long way, sometimes just as far as a master's degree would go.
Thanks, Cori. And you do have, in your particular situation, you did start out in nursing and so and then came over. So you do have a really interesting, insight on how to kind of shift gears, if you will. And Shelby, do you have any advice that you could give the students who might be undecided?
I think Hiram and Cori pretty much covered it all. I would really work to network and branch out. When I met my mentor, it was at a conference that Pima County had paid for, but they had like an app that you could like see everybody. And I found people in Vegas, and it was my mission to meet everybody in Vegas and talk to every single one of them. And the worst thing that they could say is no. So I wouldn't feel like, oh, I can't reach out to this person because I've never met them in person, but they're on LinkedIn and they have the job that I might like. Like the worst thing they can do is not respond to you or say, not interested at this time. I'm so sorry. But networking, I would say networking is probably the biggest thing. And then trying things that even if they are a little scary, or you may not feel like you're ready for or experienced in, definitely it never hurts to try something.
Thank you. Hiram, Shelby, were you just based on the track for public health from the get-go? Hiram, I think you said you transferred, but you didn't have a sort of like undecided path.
No, so I think my sort of thought process was similar to Shelby, where I think I wanted to do epidemiology and I went down the environmental and occupational health track.
Great, thank you. Well, I'm going to stop asking questions for a moment and see if anybody in the audience, any of our students here, would like to ask any questions of our panelists. Remember, don't be shy. These are connections.
Yeah,
Malaya?
hi, I have a question. So recently I've been looking towards jobs on Indeed and LinkedIn, and usually, as far as the entry-level jobs, they do require a lot of experience. So I was wondering, how can we as new graduates navigate through the work field and having intense requirements that we may not have or be equipped with, if that makes sense?
I think something that I will say that I feel like everybody that's already in their kind of career and in their public health area would agree with is if you're looking at a job and you're looking at the application and it's listing all these qualifications and requirements or preferred qualifications, even if you feel like it's kind of out of your area, like you don't have those skills yet or you don't have the experience they're looking for yet, I would still apply. There's always that chance that they interview you and they really like you and they think that you're going to be good in that role and they'll hire you. I mean, if there's really strict requirements, that can be intimidating. But for me personally, the current position I'm in, I saw that they had a preference of somebody with a master's degree and I don't have one. And I went for it and I ended up getting the position. So I would just say, don't let that intimidate you too much. Like I said, even doing like volunteer work, internships, things like that, networking, attending conferences, anything you could do goes a long way. But in general, don't let that worry you and put you off of applying. Even if you feel like you don't have a chance, you might still have a chance and you might get the job. So definitely still apply for the position.
That's great. And Shelby, or do you have anything else that you wanted to add to that? That's a really great question.
It's a great question. I would agree with Cori as just apply. The worst thing that they can say is no. At least for my position, I know it sounds super fancy, like you need a lot of experience to get my position. And like I do have my certification, I do have experience being a health inspector, but I will say the others of me at MGM, some are chefs. So I have 2 that are chefs. I have 1 that was a security guard. I have another one that was a beverage manager. So the thing is, you can always learn, right? Like you can always learn something, and that's not really what makes the job. I mean, obviously, if you're like coding, you probably need to learn before you get into it. But things like public health, you can always learn. You really need to have that basic like soft skills and people skills to work in public health, any sector. But you can always learn. And so I definitely agree with Cori that you should just apply. The worst thing that they can say is no, or they can reject your application. But you might actually be surprised at the amount of times that qualifications get looked over because they just like you as a person.
Yeah, I think that's true. That happens in all kinds of sectors, I think, as well. That was a great question. Anybody else have any questions for our panelists?
I'd like to ask a question that kind of tails off the previous question. So the value of applying to a job that you may not have all of the qualifications for. Maybe you have 95% of the 90 or the 100. But say I have that mentality of like, I'm applying to these jobs, I have 95% of this, but I apply to 10 and like 8 of them tell me no. What would be the advice to give me of like, keep my spirits up, of like, keep applying, keep going, what would be that kind of advice? Like, yeah, the worst I can say is no, but how do you handle the no's?
That's a good question. And that's really hard to like go through, right? Like it's easy for me to say like, it's fine if they say no, but it's a blow to your ego every single time that they say, no, we're moving forward with somebody else. It's like, what's wrong with me? It's really hard. And I know the job market today is difficult, right? Like I know it's difficult. I've had friends that are like, I've applied to 100 jobs this month and I've got maybe 2 calls back and the interview processes take months. I would say that I mean, this is just my philosophy, right? This doesn't have anything to do professionally, but I would say like, it's just not meant for you. It's just not meant for you. There's something always that's going to be better, that's going to be perfect for you, that you're really going to like, right? there were certain jobs that I applied to when I was in Tucson, when I wanted to get out of the health department and move to private sector. And it didn't work out. And you know what? That's okay. It wasn't for me. I applied to Shamrock. I applied to a couple of energy drink manufacturers in Phoenix, and they didn't fit. And that's totally okay, right? Like I can't imagine myself working in a manufacturing plant, like at all. Like that sounds awful to me now that I think about it. But I was like, dang, I really wanted that job. That sounded really cool at the time. But now that I have this job, this is where I'm meant to be. So I would just maybe not see it as a rejection, but maybe like a redirection into what you're supposed to be doing.
Okay, and I guess I would add to that that unfortunately it is a numbers game. And I think the biggest piece or the biggest help for you is going to be having a system to go through the whole job search process. Unfortunately, there's coaches now and people coming in the space that specifically focus on helping people in public health secure jobs. And I can share some information with Amber after this panel around that.
Something I would say, first of all, what Shelby said is perfect. Like looking and viewing rejection as redirection, I think is a really positive way to get through the no's and to move on and keep your spirits up to keep applying. Also, if you have the opportunity after you receive a rejection letter or get told no, if you have an opportunity to ask them, for any advice, can you help me with my resume? Or if you have any advice for like what qualifications am I missing or what qualities am I missing that would have made me the chosen person for this role? Asking them how you can go about preparing for your next interview and what skills you can work on, I think not only is helpful for you and will kind of even give you closure if you feel like you need it and they get back to you. But also will show them that, you're a professional and that you do care about the role that you're applying for. And it'll prepare you for your next applications and in the future.
I love how you turn your rejection into redirection. That's just a perfect way to address that. And also, I like, Cori, your idea of seeking feedback, because I do think that also shows employers and your supervisors, even those who report to you, is that seeking feedback shows that you can be vulnerable with people and that you do care about what they think, and that you always have room to grow. So I really love those suggestions. Anybody else in the student audience have a question or a comment, a concern? I have a question about you talk a lot about making connections, and that can be a very daunting task for some people, an intimidating task. What kinds of advice do you have for making connections or going about that networking activity? Maybe you could tell us maybe some from your experience or just some tips that you've learned. I'm always curious about that because there are a lot of, all of us are a little bit different. Some people are more introverted, some are more extroverted, and sometimes it's easy for people to start conversations. But just curious to know how you all went about making the connections that you've made.
So for me, I'd like to be genuinely curious about the individual. And that's how I approach it, being genuinely curious about them and the role. So it's not just like a one-sided thing. And definitely have a specific ask as far as like why you're reaching out, and try to leverage whatever commonalities you have with that other individual. So whether you guys both went to the same school, or you both have a similar interest in a specific like niche of public health. Those are my like, few tips that stand out right now to me.
Yeah, I think that you mentioned, Hiram, that you there was a professor that you that helped you make even more connections. Was that somebody you had were interested in his research, in this person's research agenda or their class, or can you?
Yeah, so it was actually it was Dr. Parker, which I think she retired. I don't remember if it was like 2 years ago or a year ago. But it was part of her the main class, introduction to principles of health education, health promotion, where she had panels, where she would invite professionals, doing work in different areas of public health. And I reached out to her because of that, to see if she had any connections with professionals in the health department, and that's how I made that connection.
That's great. That's great. Cori or Shelby, because I know you guys have mentioned conferences and whatnot. Shelby?
Yeah, I would say putting yourself in environments where networking is kind of natural.
Mhm.
So if you wanted to be an environmental specialist, there's Arizona Environmental Health Association. They have a conference every year, and those conferences are really meant to network and talk to people that you normally wouldn't get to see. So I've been to the National Environmental Health Association. They have a conference every year. It moves around the country. When I made it my mission to meet everybody in Las Vegas, it was in California. The health department paid for me to go there. I presented the following year in Nashville. And it was just kind of, they had like networking hours, like between 11 and 1 p.m. every single day was a networking hour. They had coffee stations and snacks, and you could just kind of stand at a table and just wait for people to come to you. Or in between sessions for educational sessions, I would sit next to somebody and say, "Hi, my name is Shelby. I work for Pima County Health Department. What do you do? Tell me about your life." And sometimes like I would meet people from NSF who do refrigeration certifications. I met people that were in pest control. I met a guy who trains dogs to hunt down rats in DC. But not necessarily what I was interested in, but I got to make those connections. And maybe if I was into pest control, maybe that would be good for me. Maybe that, so putting yourself in situations where networking is kind of a natural thing. I am definitely not an extrovert, especially when the situation does not call for it at all. You will not see me sitting down next to somebody and talking to them in like a very quiet conference room. But when the environment itself really emphasizes that networking, it's a little bit easier for people who may not be socially comfortable. So the Arizona Environmental Health Association has a conference every year. I would look at ADHS to see what they have. They used to have an infectious disease conference that was free to go to every year. That was really cool. MIHA has their own conference. There's tons of conferences for free. There's tons of webinars that you can go to, and you can see people on the panel like this and connect with them later. And it's never a bad thing to ask for somebody's card if they are presenting at a conference and you have further questions. I've definitely done that before too.
That's amazing. Yeah. And Anna East did for students who are on this, she did put into the chat the annual APHA organization, their conference. It will be in November in Minneapolis this year. That is, you can, talk to me, get with Anais or Amber too. There are certain, funds that, can be made available to students. I can't promise it, promise how much that would be and how many students would be, could avail themselves of that, but it is, and there's also the Arizona, Public Health Association as well. And Cori, did you have any words of wisdom? Yeah, there's a lot of different ones. Our Health Equity, Arizona Health Equity, which is one of the leaders of that and organizers is a member of OSA, Kim Barnes, up in Phoenix. Cori, we have, well, we're at 6:30, but I really would love to hear from you if you have some other information to give us about that.
I don't have too much more to add. Everything we've been talking about already is great for networking. I would say once you're really getting into the field as well, even if you're not at a job for too long, keep those connections around because they will probably lead to something else. So fun fact, Anais was my boss at my last job. She was my supervisor at the nonprofit that I started working with out of college, and here I am. She invited me to talk on this panel. So I would say just, keep those connections around when you do get out in the field, and just going to those conferences, going to those webinars, especially webinars, because most of the time they're free and they're a great way to hear more about different fields. And you're usually going to get their contact information if you ever have follow-up questions. But yeah, I think everything else Shelby and Hiram said was perfect.
Thank you, Shelby, Hiram, and Cori. This has just been a fantastic panel. I've learned a lot about not only your positions, but about public health in general, and the vast spectrum of types of jobs that one can hope to work in. We're at 6:30. Anais, Amber, do you have any closing remarks you want to give to everyone?
I just want to say awesome panel, awesome feedback. I will be following up with folks with an email with resources that Anais has shared, and Hiram said he'll connect with me and I can share those resources as well. But it's been great for everyone to be here, and thank you. And also I will say on April 30th, we will be having a dual MPH alumni panel. So if you are interested in the next steps of maybe looking into your master's, we'll be sending out more information on that.
Fantastic. Anais?
Thank you so much. I was wondering if it was going to come up that I was Cori's boss in a previous life. But you never know, those connections, like you said, and I still connect with everybody at a previous job as well. So always good to have those. But thank you all so very much for joining us this evening. And we'll be in touch, and you can contact us if you have any questions. But thank you again and have a great night.
Thank you, panelists, and thank you to those students who joined us. Again, thank you to Amber and Anais for organizing. Have a great night.